Welcome back to Wave 3 Listens. If you need eye care, you know about the Eye Care Institute. If you need eye surgery, LASIK surgery, perhaps you have a cataract, you need the very best ophthalmologist in the city. I certainly have one of them right here. Dr. John Meyer is with us. 15 years in the business. Dr. Meyer, welcome.
Thank you.
You know, before we get started on your business and this new kind of improved form of LASIK, you could obviously practice anywhere you want. Do you love this area?
Louisville's great. I love this time. I was in the military, moved around a lot, ended up settling here, and it's great. I'm tired of moving. I'm happy. I'm staying here forever.
I'm glad you like it here because it's funny. We get some of the very best in medical field and eye care, and for whatever reason, people love to stay. They stay here in Louisville because, like I said, someone like you, as accomplished as you are, I read your resume, you can go anywhere you want, and so I'm glad you're here. Okay, let's talk a little bit about LASIK. I see a lot of commercials about low-priced LASIK, but you've got something that's a little bit different and I think improved after talking to you. Tell us about it.
It is. This new procedure or new technique is called Contura. It's a refinement of the way that we can provide LASIK right now. In the past, what we did with LASIK is you take your prescription that you have in your glasses, put that in the laser, and that would treat the eye so that you should be able to function a lot better without depending on glasses. And it worked really well. But everybody in the world who had that prescription got the same treatment, even though no two people's eyes are exactly the same. Now we have the ability to measure subtle little imperfections in the front part of the eye, incorporate that into the laser, and create a treatment which is more customized and more specific for each individual eye. And the results are a lot better. In the data that the company provided the FDA, 30% of people were able to see better than they could see ever with glasses before. So this is better than any vision they've ever had. Almost two-thirds of people had better than 2015 vision, which is amazing.
Wow. So actually maybe better vision than you've ever experienced because of this new form.
It is possible to get that degree of vision that you've never experienced before.
See, this makes perfect sense to me because it sounds like before it was kind of like, I don't know, one size fits all, here we go. And if you can specialize it, because everybody's eyes are unique, you have little nuances, perhaps you've had issues, maybe injuries when you were young, whatever, you can look at each individual eye and go, okay, this is exactly for you and you only, correct?
It does. It fits more like a glove.
All right. So Contura is what you call it?
Contura is the name, yes.
Okay. For someone who is considering LASIK, what's the process? Do they have a consultation first, Doc? How's that work exactly?
They do. In order to determine whether LASIK would be best, it takes an evaluation. We'll do a complete evaluation to look at everything from the front of the eye to the back of the eye. During that time, you'll meet your surgeon. He'll go over the data, talk with you, and decide if LASIK is the best. There are other options also. So LASIK is not right for everybody, but if LASIK is best for you and you fall within the parameters, that's something that could easily take care of things real well.
Dr. Meyer, whenever I have medical experts on the show, doctors like yourself, I'm always interested in the way everything is not only developing but changing. And it seems like in your industry, research, it seems like day to day there's new innovations. This is one of them that we talked about here. And you were telling me that part of the business excites you, right?
It is. That's fun. We're developing new things every day. We have a fairly strong clinical research department at the Eye Care Institute, and we've been doing clinical research now for decades. We've got studies that we've performed and are ongoing on treatments for dry eyes, allergies, pain, infections. We've done surgical device treatments, procedures where implantable devices to treat glaucoma, others to treat presbyopia, which is the need for reading glasses that we've been working on for years. And it's nice to be able to get involved with those things early on so you can learn and get experience so that by the time those become available, we have sort of a head start. And the companies then look to us to help roll these things out. So it allows us to provide those surgeries and techniques and devices a little earlier than other people could.
Okay, you're an ophthalmologist, so I know we've talked about Contura LASIK, but let's talk a little bit about cataract surgery and other common eye issues that folks may have. You take care of those as well?
Yes.
What is the most common? I'm curious about as far as percentage of your business. I mean, LASIK, I would hope, because a lot of people, wouldn't it be nice to throw away your glasses? They'd be interested there. But cataract surgery is probably also very common.
Still is very common, yes. Cataract surgery is, if it's not the most, it's close to the most commonly performed surgery in the United States. So everybody who lives long enough is going to get cataracts. There's no way around that. That has become very easy to treat, and we have lots of different options that can provide different types and different levels of vision afterwards. So we have 7 doctors in our group that all help do different things. So if you look at the group together, probably cataract surgery is the biggest portion of our practice.
I think it's important for folks to know, because if you've been a little apprehensive, perhaps you've considered LASIK, or perhaps you have a cataract and you're putting it off, you go, I don't need the downtime. What's amazing to me about your industry and the way it's evolved is the fact that now downtime is almost non-existent in most of these surgeries, correct?
It is. With LASIK, within a few hours, most people are seeing well enough that if they had to get out and drive and take care of business, they should be seeing well enough by then. Definitely by the next day, back to driving, working, functioning pretty much normally. Cataract surgery. I had a patient just about 2 weeks ago. I operated on a Thursday morning. We were finished, and normally I tell patients go home, rest, take it easy. He said, you know, I'm on a bowling team. They're counting on me. Right. I can't be missed. Can I go bowling tonight? He went bowling that night, did great. So very easy to go through now. The technology has advanced to the point where this is really a civilized and comfortable way to go.
You know, we all know how valued your vision is, so I would think your job is very rewarding. I mean, you're changing people's lives. There are people who come in, and if you've got a real cataract issue, or if you have had bad vision forever and you decide to have Contura LASIK, then you're changing their lives in such a positive way. Bet you get a lot of hugs, kisses, and flowers the next day, right?
It is a lot. You know, we get a lot of baked goods, which is great. I love all of that. But yes, it's a happy, it's just like delivering babies. Most of the time, everybody afterwards is happy. And there are two things that most commonly people say. One is, that wasn't as bad as I thought it was going to be. Yeah. And the other was, I should have done that a long time ago.
See, I like that. I like the sound of that. So don't wait any longer. Quit being, quit with the pushback. Don't be apprehensive. Be positive, because I'm telling you, it is amazing, the innovations at the Eye Care Institute. Dr. John Meyer, who is a board-certified ophthalmologist. There's the information up on the screen. Consultations. Now, if folks aren't exactly, what about, now as the kids back in school, perhaps your son, your daughter has an eye care issue. You take care of those as well at the Eye Care Institute.
We do. We have doctors in the practice who provide a broad spectrum of needs. So we can take care of routine eye care from, kids' school exams, glasses, contact lenses, to retinal detachment surgery, macular degeneration, diabetes, glaucoma, cataracts. Pretty much everything that needs to be done, we should be able to do.
Dr. Meyer, one more question for you. I love this conversation. It's very interesting to me. I've had so many eye issues that it's particularly interesting to me. But of an innovation that may be a little bit down the road, or something that you see that there's being research done now, what excites you the most?
The biggest thing right now in my mind that is going to change is the treatment of presbyopia, which is the need for reading glasses. There are a few surgical devices that can be done that can allow you to read again without changing your distance vision. Those are waiting to be approved. The one thing that excites me the most is that a company that's developed an eye drop. You take one drop in the morning, it allows you to read throughout the day, wears off in the evening, put another drop in the morning, start over again. So it's non-surgical, non-invasive, and if that works as well as the preliminary studies indicate, that could be game-changing. That could be huge.
That's pretty exciting. I want to invest in that company.
Yes.
All right, again, Dr. John Meyer, the Eye Care Institute. We'll put the information up on the screen real quickly. If you have an eye issue, or if you have a question, this is the number to call. This is the guy to see. Again, there's the number, there's the address, and there's the website as well. All right, coming up on Wave 3 Listens. Get ready, folks. Halloween is on the way. You need Halloween safety tips, and we have them with Kaufman and Stigger next on Wave 3 Listens Live.
Back in 2000.